Okay. I'm about to answer my questions on my perceptions of evidence-based practice. It's funny to me. I was interviewed by my friend who went through the ISU program for these exact questions, and so uh, it's I'm excited to see the same track of learning experience that she went through and how my perceptions of evidence-based practice are going to change. But for right now, in the meantime, here are my initial perceptions of EBP. The first question is, what is evidence-based practice? I think that it is practice, practicing techniques or skills, tests, evaluation, and diagnostic techniques that are supported by evidence. The next question is, how do you utilize evidence-based practice in athletic training? I am an active member of the NATA, so I'm, reading up on their position statements, which are, coming from evidence-based practice research and things along those lines. I also attend my district conference, and pretty soon, my national athletic training conference, which has people that present evidence-based practices and techniques, and hopefully will give us some options to practice those techniques while we're there. I think that reading stuff from an article as evidence-based is important, but I find a lot of benefit from getting the opportunity to practice hands-on techniques that are evidence-based. But maybe that's only because that's been my focus in the past, is improving my clinical tools instead of the way I conduct my program and things like that. Even at the beginning of doing all this research for ISU's DAT program, I'm finding that I've focused a lot more on how to be a better clinician than I have focused on being better organizationally and documentation and things along those lines. And I'm now realizing that there is a lot of evidence-based practice that channels or that speaks to those aspects of athletic training and healthcare organizations. Do you feel prepared to practice evidence-based techniques? So it's questions like that bring me back to what I was saying a second ago. I focus more on techniques than I ever have the organization of my clinical practice. Do I feel comfortable practicing evidence-based stuff? I have felt comfortable when I've gotten enough practice doing evidence-based practice techniques. I know that sounds redundant, but let me explain. When we go to a district conference, or any conference for that matter, and we do some sort of workshop, unless we're partaking in like the 5-hour-long courses, we're only getting about an hour's worth of evidence-based practicing of techniques. Half of that hour is usually taken up by the support and evidence and the lecture portion, proving that it is, found to be evidence-based. So the other half hour is spent getting better at the technique, and I don't necessarily feel like that's that's going to it doesn't make me feel confident or comfortable to practice those techniques all of the time. So yes and no, it depends on how much practice I've had with that EBP technique. How much experience do you have with evidence-based practice? This is my 6th year of practicing athletic training. I feel that I have a lot of experience with evidence-based practice. However, I don't feel that I looked at evidence-based practice any differently than exactly how it was taught to me. I don't feel like I've explored, new techniques that are coming up and really sought out a position on those things. So I feel like I have a lot of experience in the experience that was taught in my undergrad. I am looking forward. I joined the DAT so that I would get more experience, not just learning more techniques that are evidence-based, but really understanding what's going into evidence-based practice and what is being left out of evidence-based practice. What are some downfalls are there any downfalls of only adhering to evidence-based practice? And I haven't really looked at it critically in that way. So my experience in that manner isn't very vast. I think that's the last question. Something that I've been asking the other people that I've interviewed was, have I seen evidence-based practice expand or change, or did my understanding of evidence-based practice change? And for me, it has, I think, a significant amount. When I was first learning about evidence-based practice, when my professor in my undergrad first explained that there was a large movement going towards evidence-based practice, I thought to myself, what have we been doing for the last, 2,000 years when it came to medicine? Practicing medicine is one of the oldest jobs on earth. And it's interesting to me that if we didn't have any evidence backing up what we were practicing, then why were we doing it in the first place? So it was probably based on, people saying, oh, I felt like this work and I felt like this work. And it was really about getting that communication pieces together. So when he first taught this to me, I was more surprised that it's a recent push to be following evidence-based practice. And since I've started doing my own practice, I find myself falling back on what they taught me was evidence-based practice. But I'm excited to expand into questioning, how I can include evidence, how I can conduct my own research, and how I can prove that things are evidence-based and that they are working. So that's how I feel like it's changed. Thank you for listening to this long-winded explanation. Now, okay, hello, friend. Thank you for taking the time to do this. Let's start off by just, can you state your name and your position and title?
Okay, my name is Stephanie Odell. I am the sports medicine teacher and athletic trainer at River Ridge High School in Lacey, Washington.
Okay, thank you. And how many years have you been practicing?
I have been practicing for 7 years, 6 of them at River Ridge.
Okay, good to know. Thank you. All right, so the very first question is, what do you think evidence-based practice is?
I think evidence-based practice is basing the treatment and rehab options that we do for our patients on empirical evidence, and not just one study, but several studies over time that show that certain treatments are better than others. Yeah, that's it.
Okay. And then second question is, how do you utilize evidence-based practice in the athletic training room?
Well, I definitely use the NATA position statements in the athletic training room, as well as, attending our state, or I guess our district conferences,
Right.
state conferences. So take that information and apply it back to my practice.
Okay. Do you feel prepared to practice evidence-based techniques?
I would say after I attend a conference or a class specifically, sometimes when you're just reading an article, especially if it's hands-on practice, you don't feel 100% prepared. Like, you feel confident in yourself, you could figure it out, but you kind of want that hands-on teaching from someone to help you feel 100% prepared.
I agree with that. How much experience do you have with evidence-based practice?
I would say a fair amount. Right when I was graduating from my athletic training program was right when they were switching to evidence-based practice decisions. So
Okay.
we were working on like the PICO method and how to search for specific articles and studies that showed like specific populations and how treatments affected their outcome. So I think I'm definitely capable of finding that information. And then obviously every time you go to a conference or a class, you pick up more and you learn more of how to apply it effectively.
Yeah. Last question that I have, you kind of touched, this is my own question,
Yeah.
that I asked someone that had like over 10 years experiences. Have you gotten to see an evolution of how we have focused on evidence-based practice? You said that when you were first starting to get into this, that they really switched to, you felt focusing on that. And
Yeah.
just to give the listeners a little context on this, I felt the same way. And I think let's see, you graduated with your undergrad in 2012.
Well,
Okay, so you're 1 year behind, me, and I was also feeling like when they were emphasizing it, it seemed like it was brand new. So my question is this: do you feel in your years of practice that the focus on evidence base has evolved more since we started focusing on it, and or do you understand it or utilize it a different way than when you first began doing athletic training?
yeah, I think when when they first started teaching it, it was really about finding that information.
Yeah.
And because in my mind, I just assumed that that's what we were already doing. That why would we be doing things that weren't
Or
evidence-based anyway?
evidence-based, yeah.
That was kind of odd. But I think it definitely has evolved. Obviously, you have the EBP requirements for the NATA, so that I don't want to say forces, but it helps you focus more on evidence-based practice. But I guess my trouble with that is I think it's a good requirement, but they still don't have a lot of, what's the word I'm looking for, way to support us for doing that. Like, yeah, okay, if you go to a conference, they'll give you, they have 3 or 4 things.
Right.
But in my mind, it's like, okay, if that's our focus, then everything should be evidence-based, or we should be getting to the point where most of our stuff is evidence-based practice. So it's kind of hard when you have hundreds of thousands of people trying to get evidence-based practice and there's not a lot of support as far as classes. And I know it takes some time to get there, because you have to let the evidence show. You can't just see one study and say, yep, that's the evidence. You have to give it time to develop.
Yeah.
So I think it's evolving and it's going in a good way. It's just, I would like to see more support for it.
I could see that. Okay, well, thanks for taking the time to do this. I really appreciate it.
Of course, anytime.
All right. Our short break there. The next question is, how much experience do you have with evidence-based practice?
How much experience do I have? Well, it's been around for a while now.
Right.
So in the clinic, probably at least the last 8 years or so, we've been trying to make sure that we are up with the research and what works best for our clients. And trying to make sure that our continuing education courses that we have our clinicians go to, and myself included, that those were evidence-based by and large.
Yeah. So that was my question is, how have you seen it? Have you seen any notable evolution in all of your years between being certified and now in the use of evidence-based practice?
Yeah, I think there's been some, but I think there's still some utilization of modalities and things like KT tape and stuff like that really aren't evidence-based.
Right.
That really are, don't have good evidence base behind them that ATC still accept and use.
Right.
And some of it is just anecdotal stuff where they tried it and they got better. How much that's a placebo, I don't know, but there are some things out there that I think are still utilized by PTs and ATCs that aren't evidence-based, some of which has a track record and a history of being somewhat effective for certain patient types. But I think there's been more utilization of that since there's been more of an emphasis on it, and more availability, and more universities and curriculums that are funding research,
to
programs
support it, right?
To support it, yeah.
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 Okay, well, thank you for your time. An introduction of who you are and how long you have been practicing.
Well, my name's Dave Knoppel, Knoeppel. I was certified in 1973 and been an assistant athletic trainer at University of Oregon, head athletic trainer at UNLV. I got a PT degree at Indiana Central University, and so I've been practicing as an ATC for 46 years.
Wow, that's awesome.
Volunteer my time to help wherever I am locally,
Oh, okay.
semi-pro teams and
Gosh, that's
high school
awesome.
levels, yeah.
So are you at a PT clinic now and then help
I
for...
retired in 2014.
Okay.
A clinic that I co-owned in Longview, Washington. Periodically still go back and do some stuff, work with orthotics,
Got it.
and work with the high school, just volunteering my time.
That's awesome. Well, thank you for taking the time for
Sure.
this interview. So all of these questions are kind of based around evidence-based practice. The first one is asking, in your own words, what do you feel evidence-based practice is?
Well, it's kind of the scientific basis of what we do as athletic trainers. In all the allied health professions, that's been the trend is to go to more scientifically based research, verified and validated programs of treatment, and developing protocols as a result of that.
Okay.
So,
That's a good explanation. How do you utilize evidence-based practice in the athletic training room?
well, to the greatest extent that I can, I stay up on the research and the best practices that the NATA and other allied health fields like physical therapy are utilizing. I think there's a modicum amount of experience that a person needs to have in addition to the exercise, the practice-based type of research. So there's a mix, I think, that's important. And as people are longer in the profession, they gain a better insight as to how to use that. But we try and use the things that are going to be the most effective as far as treating injuries and doing rehabilitation and that sort of thing in the clinic. And also, the training room is a little bit more, in the high school is a little bit more limiting because you don't really have a lot of assets there that you can work with. Since I'm a volunteer, they don't have a lot of equipment and things. But I still am able to take kids into the clinic and treat them in the clinic. And we do a lot of pro bono stuff for the kids, so then we're able to apply appropriate care techniques there.
That's good to know.
Yeah.
Third question. Do you feel prepared to practice evidence-based techniques?
For the most part, I think it's for me it's a little bit more of an effort to stay up on the literature since I'm retired. So there is so much of it, and also because I'm dual credentialed, so I've got the PT stuff and I've got the ATC stuff to look at. But yeah, I think it's important for continuing education coursework for people to be growing in the profession and to continue to make sure that they are taking the evidence-based types of curriculums and continuing education so that they can stay up with everything. So I try and integrate it into the continuing education programs that I take, and also, of course, the NATA requires at least 10 hours.
Right. I wonder, it's probably a benefit to have to maintain that dual credential, that you get experience doing EBP for both PT purposes and ATC purposes.
Definitely.
Excellent. The next question, let's see, did this die on me? Okay, we might have to pause.